Abuse Wisconsin. For those of you who don't know, we're the statewide organization, statewide voice for victims of domestic violence. We are also the membership organization for the more than 70 domestic violence programs that scatter the state of Wisconsin in all 72 counties and 11 tribes. I want to start by giving you a little bit of background on this report that we're releasing today. We have and Domestic Abuse Wisconsin has been chronicling this very grim reminder, chronicling homicides since the year 2000. So this year we're releasing 2017. Obviously we're in 2018, so we can't release a report for this year while we're still in it. We chronicle the deaths of people who die as a result of domestic violence. What we know now is in this past year, 2017, people died at a rate of one death every 6 days in Wisconsin. Some of the main findings for us to consider were in 2017, as opposed to 2018, there were 40 individual incidents of domestic violence homicide, as opposed to 51 the year prior, with a total of 62 deaths. I want to be clear that we count amongst the deaths not only the victims who were killed by a perpetrator, but then when the perpetrator kills him or herself, we also count that death, because that also is a death related to domestic violence. Families are impacted by that person's killing of their partner and then their choice to kill themselves. Communities are greatly impacted. Co-workers and neighbors and friends are all impacted by that death as well. And we think it's really important for us to call attention to it. In 2017, over 42% of the victims of intimate partner homicide were killed after the relationship ended, or when one person in the relationship was taking steps to end the relationship. It's a very important thing for us to know. Very many times we often hear people say, why doesn't the victim just leave? And it flies in the face of what people say when we recognize that leaving often is a critical trigger point that may result in homicide. And we who advocate for victims of domestic violence often very strongly call to communities to recognize the best decider of when it's safest to leave is the person who's the victim. And that we need to withhold our judgment about why someone stays in a relationship for any length of time. We just know that no victim in Wisconsin should have to take the courageous step of leaving a violent relationship without first enacting a personalized safety plan and working with a domestic violence agency and advocates who can help them figure out the best strategies for them to leave safely. Also important for us to note is that victims in this report reflected the span of life from less than 1 year to 88 years old. In fact, across the span of our collecting this data, I really think it's important for us to note that overall 20% of the people killed are elders. People who are dying in later life, either through abusive relationships or familial violence. We often think of the golden years as a time when it's safe and people retire to a relaxing life, and we know that domestic violence continues to happen when people age. Consistent throughout the years of us gathering this report, firearms remain the most common method of killing victims. I will note that this year that rate is at 70%. That is one of the highest rates we have seen for firearms use. And we have a situation where we do not yet have the political will to implement things like universal background checks, so that domestic abusers can't obtain firearms in ways where it's often illegal for them to obtain a firearm, but they can still access them through online stores such as Arms List or by going to a gun show and seeking out a gun dealer who is not a federally registered gun dealer. So there's many ways that domestic abusers can still access firearms, and until we close those firearm loopholes and implement universal background checks, we will still be in a situation where people who are restricted from owning firearms can still get them. In this report, there were 11 of these homicide shootings where the gunman was legally prohibited from possessing a firearm, but still was able to obtain one. In 2017, homicides were committed in 19 separate counties. About 8% of the homicides occurred in urban areas, 42% happened in rural communities. And many of the 2017 homicide cases reflect the risk factors that research has found to be particularly associated with lethal violence in relationships. These include, among other factors, threat to use or actual use of a weapon, threats to kill, stalking, strangulation, obsessive jealousy, and sexual assault. Things that we know is one homicide is too many, and one Wisconsinite living their life, losing their life as a result of domestic violence on an average of every 6 days is completely unacceptable. I think I want to just address this in the context of the world in which we've been living in the last couple weeks. When we have situations where victims of violence are not believed, and the Me Too movement has largely been about sexual violence, but domestic violence victims are also among a category of victims who are frequently not believed. When people wind up killed by their perpetrator, I have to ask myself, do you believe her now? Do you believe what she was saying all along now? Do you believe that she said that she was afraid of him? It's extremely important for us to think about that, and you might not readily understand the context, but we have many victims who leave, who share children in common with the person who is their perpetrator, and courts frequently acknowledge violence that's happened through criminal convictions or issuance of restraining orders against a violent person, and then when child custody and physical placement, which we commonly call visitation, becomes an issue, those courts are going to put those people right back together, even when they know there's a history of domestic violence. It's almost like they don't believe it happened in the first place. And those victims are particularly at risk when they're doing things like exchanging their children with somebody who's been violent to them. And if we remember that leaving does not always equal safety, the risk certainly goes up. Domestic violence homicides are preventable. When communities organize to prioritize victim safety and offender accountability, we can save lives. In the past 2 years, End Domestic Abuse Wisconsin has been implementing a lethality assessment protocol. It's an evidence-based protocol that came out of Johns Hopkins and the state of Maryland. And we are strongly encouraging communities across the state to adopt that protocol. Dane County is one such community that has not yet adopted that protocol. And as we know, yesterday there was a domestic homicide here in Madison, and I understand that Chief Koval will be doing a press conference this afternoon to discuss that homicide, and it was a homicide suicide. Each year when we write this report, we want to focus on the fact that this year there's 62 deaths, but each year when we write this report, we really want to focus on the fact that one life lost is too many. And that if we all work together, that someday we may have a different result. But it will take communities working together. It's not the job of the domestic violence program alone, or law enforcement alone, or a DA or a judge on their own. It's the responsibility of every individual who comes into contact with somebody who is in an abusive relationship or with somebody who is abusing another, to figure out how we might create a society in which all victims live freely and safely in our society. With that, I'm going to introduce to you Chief Eric Atkinson from Menomonie, And he's going to talk about the importance of the lethality assessment protocol for you. And so I'm going to turn it over to you, Chief Atkinson.
Thank you. As she said, my name is Eric Atkinson. I'm the Chief of Police for the City of Menomonie, and it's an absolute honor to be here today to talk about such an important topic. Although we have seen the domestic violence homicide numbers go down, we must remain vigilant as a community to make sure that that number continues to trend downward. And I agree wholeheartedly that even one person who is murdered due to domestic violence is one too many, which really highlights the importance of what is taking place in our society and why we need to take measures to reduce such crimes and bring awareness to our citizens. Domestic violence and domestic violence homicide certainly hits very close to home for me. Over the past 20 years, I've been to hundreds of domestic violence complaints, and in fact, the last 2 homicides I personally investigated as a detective were domestic violence related. One of them was a very young couple, and the other one was an elderly couple. So I appreciate you highlighting the fact that domestic violence homicide knows no age limits. One of the measures that we have been taking in law enforcement as community shareholders as well is working together to form coordinated community response teams to try to identify best practices to reduce domestic violence homicide. And I'm very pleased to be part of the Maryland Network's Lethality Assessment Protocol program in the city of Menomonie and Dunn County, Wisconsin. I'm also very pleased to see that many of the counties in Wisconsin and municipalities and villages have been adopting the Lethality Assessment Protocol. This is an evidence-based tool that gives law enforcement the ability to identify those victims and survivors who are potentially high risk for homicide. The lethality assessment protocol consists of approximately 11 questions, and those simple 11 questions can help identify those who are most high risk and high need. And really one of the things that I like best about this protocol is that not only does it identify who is high risk and high need, but it also allows us to get those persons in immediate contact with victim advocates and domestic violence advocates, so that way they can understand that there is hope, that there are resources in the community and there are people that care for them. And it truly is a community response. As you said, this cannot be done by law enforcement alone or advocates alone or just citizens alone. It has to take an entire community to do this. And for those of you who are unaware of the lethality assessment program, I would strongly encourage you to educate yourselves about the program. It is something that undoubtedly can save lives. It's the reason why the men and women who wear uniforms put that badge on their chest. It's the reason why our advocates and victim witness personnel work with others. It's the reason why as community members we need to be looking out for every single one of us to make sure that this domestic violence does not continue. And to touch one last part too, talking about firearms and related domestic violence, circling back to the last 2 victims, actually there were 3 total, those were both firearms related incidents. It is a significant problem in domestic violence, so we cannot lose track of that or lose sight of it. It is something that we must really be vigilant and ensure that we're keeping weapons out of very violent predators. And with that, I thank you very much for being here today and supporting domestic violence awareness. Thank you.
Next, I'd like to introduce Representative Lisa Subeck. She's going to talk to you about firearms legislation.
Thank you, Patti. While the rate of death due to domestic violence in Wisconsin did go down last year, the fact remains that one individual dies, as you heard from Patti, every 6 days as a result of domestic violence. This is a fact that I believe we can and we must change. These are deaths that are preventable. This weekend here in our very own community, we lost a mother to domestic violence. Though few details have been released at this time, it has been widely reported that she was shot by an intimate partner in an apparent murder-suicide. Last year, 4 lives at the hands of an intimate partner were killed at the end of their relationship when trying to leave that violent relationship. As a member of the Governor's Council on Domestic Abuse, I know about the incredible efforts of our local service providers who provide services to victims and survivors of domestic violence. I know how hard they work, and I know that without them, these numbers would be far worse. But they can only do so much with limited resources. Our resources in the state are stretched far too thin. Our local communities still struggle to serve the large number of people in need of services. Too many victims are still left with nowhere to go or cannot find the support that they need in their communities. It is incumbent upon those of us who are here at the state capitol to do more to ensure those resources are available. In addition to expanding our resources and prioritizing, making victims of domestic violence a priority, in addition to prioritizing those services, we can make policy changes that would prevent the tragedy of victims dying at the hands of their abusers. This year, as in past years, firearms remain the single most common means of perpetrating domestic violence homicides here in Wisconsin. In 2017, firearms were used in 70% of the domestic violence homicide incidents here in Wisconsin. And in at least 11 of these, as you heard earlier, at least 11 of these incidents involved gunmen who were legally prohibited from possessing a firearm. Women make up the vast majority of domestic violence victims, and the presence of a gun in a domestic violence situation makes it 5 times more likely that the woman will be killed. Our gun laws in Wisconsin leave women unprotected, and there is so much more that we could do. We must work to expand background checks. We have a loophole in our Wisconsin law that allows individuals to purchase guns online through ads placed on websites online, or to go to a gun show and purchase a gun from a dealer who isn't licensed, or to go through an individual in their own community who isn't a licensed dealer, and they can purchase a gun without any background check at all. My Democratic colleagues and I have proposed closing the background check loophole. It is a common sense measure that is widely supported by the general public, widely supported in the public by Democrats and Republicans alike. Yet, when my Democratic colleagues and I proposed this here in the building, Governor Walker and the Republicans refused to even consider the bill. They stood in the way. About 3 years ago here in Wisconsin, Republicans repealed Wisconsin's 48-hour waiting period for the purchase of a handgun. This cooling off period saved lives in our state, and my Democratic colleagues and I have fought to bring it back. Yet, we have not been able to get even a hearing on returning this cooling off period. We can and should address how firearms are stored. I have offered bills that would require that guns be stored in locked safes if somebody prohibited from owning one is in the home. Republicans haven't even given the bill a hearing. And we should move forward to pass a bill that was introduced by my colleague Melissa Sargent that would enable a court to temporarily remove firearms from an individual who presents an immediate danger. It is incumbent upon us to do everything in our power to keep guns out of the hands of those intent to do harm. It is shameful that so many women in Wisconsin have lost their lives to gun violence at the hands of an intimate partner in a domestic violence situation, particularly one who has been forbidden from owning a firearm in the first place. This is preventable. I urge my colleagues in the state capitol to pay attention to the report that is being presented to us here today. Preventing and ending violence, preventing and ending domestic violence, and preventing and ending gun violence should be a bipartisan effort. Too many women are dying as a result of domestic violence. With more resources and common sense measures to prevent gun violence and keep guns out of the hands of those intent to do harm, we have the power to change this. Our actions here in this building, in the state capitol, can save lives, and the time to act is now. Thank you.
Thank you, Representative. I do want to say that End Domestic Abuse Wisconsin is a nonpartisan organization. Obviously, Representative Subeck is in a partisan office, so I feel like it's important to be really clear that we actually work avidly with both Republicans and Democrats on any law that we think will strengthen safety for victims. We are now open for questions if folks have any questions of any of us who spoke here today.
I have just a clarification. On this overview, it says domestic violence homicide incidents, and then it says victims of domestic violence homicide. What 140 and 145?
Okay, so there is an incident. It's an event. So as Chief Atkinson pointed out, in one of their incidents, there were 2 victims. Okay. So there's one incident, but 2 people died during that incident. So so we're trying to capture both the count of how many times it happens and then how many die. And sometimes that number can be quite high. Every now and then in Wisconsin, we've had more mass shootings that come out of domestic violence. So we've had as many as 8 people die in Crandon like 10 years ago. So out of one domestic incident. Other questions?
I guess moving forward, what's next? I mean, what's the plan for 2018? I know we're kind of towards the end of 2018, I guess going into 2019 now.
Sure. Yeah, obviously, you heard a little bit about our work to implement a lethality assessment protocol across the entire state. In fact, this year the Attorney General increased a grant to End Domestic Abuse Wisconsin so that we could work diligently to implement, to increase our staff and to implement connecting with law enforcement agencies and local domestic violence programs to see if we can expand the use of that lethality assessment protocol. 30 communities, I'm sorry to ask, how many communities are
21 counties.
Okay, so there's 20, so Wisconsin has 72 counties and 11 tribes, so the tribal jurisdiction is a little different. And we have 21 counties right now that are in some form or another implementing the lethality assessment protocol. Some of those counties, it's county-wide, so all of the law enforcement agencies in that county are participating. And in some counties, maybe it's just one law enforcement agency is implementing it. Our goal is to really start to think critically and use this tool, which is an 11-question tool. It's evidence-based. It's been thoroughly researched. In Maryland, after they fully implemented it statewide, they saw homicides drop precipitously. And that's what we're hoping for here as well, is to get law enforcement agencies engaged and working with their local domestic violence programs to implement that lethality assessment protocol. And to start just every time they go to a domestic to ask those simple questions. Those questions will give them an answer depending on which questions are answered. They're weighted in some ways, and how many are answered affirmatively will help them understand who's at highest risk for homicide, and will help them to connect that victim right there at the scene to the local domestic violence services.
And I know there hasn't been a lot of information put out about what happened this past weekend,
right,
but
right.
From what you know as an organization, how could it have possibly been preventable?
Well, so we don't know anything about this particular case, but obviously it could have been preventable if police had prior contacts with that person and had implemented the lethality assessment protocol, had asked those questions, and they had connected that person with services. It is really hard right now to keep guns out of the hands of domestic abusers because there are so many loopholes. Our laws are very clear in Wisconsin, both in our state and federal, that people who have convictions for domestic violence or who have a domestic violence restraining order against them cannot possess or obtain a firearm. So if those people were to go, for example, to a federally licensed gun shop, that would come up in their background check there. Unfortunately, there has been no will to close the other loopholes that exist and to implement universal background checks. As Representative Subeck said, the majority of Wisconsinites, both Democrats and Republicans, and again, we are not partisan, the majority of Wisconsinites support universal background checks because there have been far too many mass shootings and far too many shootings, and people are alarmed that people have such ample access to firearms. So this is something that we really do have to work on. Obviously, it is the most lethal weapon that you can use on another human. People can die from knife wounds or being hit with a car, but it is far more lethal to be shot than it is to be stabbed. Any other questions? Okay. We'll be available for individual interviews if any of you want to talk to any of us individually. And then at 11:55, we'll be with members of the Zonta Club, Domestic Abuse Intervention Services, and Unidos Against Domestic Violence, reading the names of the victims, 55 victims of domestic violence homicide this year. In this room. We were planning to be outside, but the weather had a different plan for us today. So if you want to stay to film that, that would be great. With that,
Thank you.
Thank you.